everyone, and welcome back for those who are returning listeners, and welcome to those, and this is your first episode. My name is Dr. Shirlea North from North Star Physical Therapy, and this month is PT Awareness Month, Breast Cancer Awareness Month. There are so many other awareness topics this month, so today I really wanted to kind of get into this new trend that's starting within the physical therapy world really kind of recently in the last couple of years. And I'm super excited because there are more clinicians that need to be like me and have not just one specialty necessarily, but then to be able to cross bridges and see connections between a couple of these specialty areas. So for example, the title and the topic of this episode is why are pelvic health and lymphatic health PTs so sought after? Well, number one, I'm one of the only physical therapists and lymphedema therapists within the Northern Virginia area that also treat those with lipedema. You don't know what lipedema is, I want to know the difference between lipedema and lymphedema, go ahead and check out one of my other podcasts and get a little bit more in detail into it. But it's really kind of sad that a lot of lymphedema therapists in my area are kind of hooked within the insurance-based system and will only see lymphedema clients either during or after cancer treatments, specifically breast cancer, which is completely needed. But you can get lymphedema from other causes. Cancer can be anywhere. It can be treatment like prostate cancer, for example, or another pelvic cancer, or somewhere else in the body that can get inflamed and swollen and irritated, or lymph nodes removed and develop lymphedema. It could also come from a vein issue. And so there's actually maybe 2 clinics in my area, and I'm in a very populated area. And there are only 2 other clinics that have lymphedema therapists that will see a client for lymphedema from vein origins. And one of them will only treat like half a leg at a time, which is ridiculous. So all more reason for me to do what I'm doing at North Star and being a like private practice where we will see the entire body from whatever origin it may come from. We got to treat these symptoms, right? So lymphatics have become a big wave of knowledge that's needed. I mean, it's really, the lymphatic system is so crucial to our cardiovascular system, to our immune system, as well as like our hormones that can get involved. It's quite amazing. And our body doesn't work in silos, and neither does the lymphatic system. And what's amazing is that one of the functions of the pelvic floor, that muscle group down there in the pelvis, is to act like a muscle pump for the pelvic lymph nodes. Again, check out the podcast. But we need to have clinicians that know both, okay? It's kind of like a both and. To be a really great pelvic therapist you absolutely need to know orthopedic things going on. You need to know so like the bones and the joints and the tendons and the ligaments, you know, like the muscles, and you need to know the like blood supply that's going on in the area. You need to know the things above and below the pelvis. You need to know how the nervous system is involved in this area. There's so many things there. And one thing too are the lymphatic system. Everything drains towards the trunk, especially from the lower extremity. And so I have seen a lot of lymphedema therapists that have seen the importance of using the pelvic floor muscle group as a muscle pump for that. We often are training clients of how to do that through diaphragmatic breathing techniques. We can potentially integrate a Kegel, right, an activation of those muscle groups. But we are doing a disservice as lymphedema therapists if we're not teaching the client how to properly use that muscle group. Well, if you're not trained in how to properly assess that externally and internally, and even in different positions, then you're doing your client a disservice, and you really need to refer out to a pelvic floor therapist if you don't know how to do that, because don't pretend, okay? And then as a pelvic health therapist, we're doing a disservice if we're not helping pump that lymphatic system, especially if someone just had a baby, or if they just had surgery in the area, or there really are signs and symptoms of pelvic congestion. So I was involved with a conference earlier this year just for this, the combination of pelvic health and lymphatic health, and how it really goes hand in hand. They really do play off of each other, and you really can deliver great comprehensive care. And so when I started North Star Physical Therapy, I realized this years ago, and I try to incorporate that when I was working as a staff clinician at another clinic, and I just got so bogged down and so limited because of insurance limitations. And I said, screw this. I want to start my own thing because of how important this is. And so October, we're celebrating 3 years of North Star Physical Therapy's existence and treating clients. And I think that's a huge part of my success is that I do screen out. I do look outside of the box and take a step back and really look at every little contributing factor. If I'm working with a pelvic health client, I'm making sure lymphatic flow is doing okay. If I'm working with a lymphatic health client, whether it be lipedema or lymphedema, and especially when I'm teaching MLD techniques, I absolutely want to make sure we're screening out for any other pelvic health concerns and making sure that we can really activate that muscle group, regardless of what genitalia you may have. Everybody has pelvic floor muscles, and everybody should be able to turn them on and turn them off, so to speak. So that is part of my programs here. I always give all of my new clients a welcome folder. And then within the first couple of sessions, I'm giving them a handout with if they are involved in any one of my programs and what we are assessing for, what are we treating, what are we screening out. And so they will always see I'm screening for other things. We deliver comprehensive care here, holistic care. And so we want to make sure that, when you are a pelvic health client, we're screening out any kind of swelling or congestion anywhere else in the body, especially within the pelvis, and how we can use our muscle groups. But if we're coming in for potential pelvic pain and tightness, we have to resolve that so that we can utilize that muscle group to its best and the fullest potential. If you're coming in under my lymphedema or lipedema program, absolutely screening out for pelvic health things and making sure we can turn on those muscles the way that we need it for that drainage. And you'd be so surprised that actually almost all of my lipedema clients, I end up also assessing their pelvic floor because of just the almost syndrome or condition and the symphony of symptoms that those clients also have run hand in hand with pelvic health symptoms. They almost always have some urinary, some bowel or pelvic pain going on as well. And so it's quite amazing to be able to help somebody throughout the whole journey and not just, the conservative measures for lipedema, but then also be able to treat any kind of pelvic health concerns, because that's really what optimal health is. And isn't just treating the one little body system, also all of it. So it's super important that pelvic health therapists know a little bit or get certified in lymphedema. And it's amazing how more lymphedema therapists are becoming pelvic health therapists because they're like, oh my gosh, I can definitely do this. I have a great hand technique from performing manual lymphatic drainage all the time that you have this sense, the touch. You can be really soft and you can go deeper. And lymphedema therapists really do have great handwork and hand skills, which really bodes well within pelvic health because it is a very sensitive area and the very gentle tissues and things like that. But then we can utilize that skill set in that arena as well. And so I kind of always, challenge my pelvic health providers out there that do not do any internal work to make sure your hand skills are amazing, that if you're only treating externally to the pelvis, totally your choice. And I get that we want to make sure we're encompassing all that we can. So I kind of feel the same way when I'm talking to a lymphedema therapist and they're training externally, but they know how important that translate internally, and why not keep going with that skill set to get some further training in pelvic health conditions and techniques of how to treat externally and internally. But I just really strongly urge that any therapist that's going to include the other specialty, that they do more than just one weekend course. So that's my pet peeve is that people are seeking this kind of comprehensive care. So we need to be better clinicians and not just stop on one weekend course. There is a huge hospital-based system where I am, and a lot of them, and even actually other bigger fish, other bigger companies in the area, that they will, pay for their clinician to go to just one weekend course, maybe two, and then say, oh, we have awesome pelvic floor services now. And it's really just a marketing thing. And so I often get clients that maybe started with a different pelvic floor PT and will come to me because they weren't getting what they wanted. And I just ask them, like, did they do any kind of internal work? Or did they do any, thing X, Y, and Z? And they're like, no, like not at all. They just kind of gave me some like exercises and like, that's it. And like just told me to go get a pelvic wand. And so they didn't show you how to do it. They didn't like assess you internally. So how could they give you a wand? It just goes down a rabbit hole. So I really, really encourage that if you are moving forward with your skill set as a clinician, to not just take one weekend course. These client populations deserve better care, and they are typically more complex because there is a nervous system involvement for both. There is a muscular system involvement for both. There is a vascular system involved for both. Like, we need to be better in knowing all of those contributing factors, and that takes more than just one weekend course. But I really do think that the combination of pelvic health and lymphatic health is becoming more and more sought after, with more and more research coming out on how important it is, especially within the perimenopause, postmenopausal life phase, because of just how much change there is because of the hormonal change. And it's really quite amazing. So I'm really glad that clients are being an advocate for themselves, for better clinicians, more comprehensive clinicians, and clinicians, we need to be better with that too. So it's super exciting that people are seeking out specific specialties. Or for those that are like, I have no flipping idea what you're talking about, feel free to look it up. Feel free to reach out to me. DM me, check me out on like Instagram or Facebook. Feel free to check out my website as well, and message me. And I'm more than happy to hop on a virtual consultation so we can kind of talk through if there's anything particular, if you feel that, just kind of answering some questions. And if it's like, yeah, you should definitely look into somebody close by and making sure they kind of treat X, Y, and Z. I love to be able to consult clients to help guide them to the best clinician. If it's not me, it's definitely someone else, maybe closer. But it's exciting world that we are being better with looking up information, and we are being better advocates, but then also clinicians out there, we need to be better with our continuing education. If you're getting bored in whatever you're doing, then you need to stop being a clinician, right? It's always about learning. But we really need to see the connections between how the body works. And especially within pelvic health, lymphatic health, there's a huge connection there. I kind of see it as like a Venn diagram, right? And that little middle sliver of the diagram is like where I live all the time, right? It isn't just pelvis. It isn't just lymphs. It's both. So yes, please, people, seek out, get to know what pelvic health is all about. Seek out and get to know what lymphatic health is all about. You don't have to necessarily have a diagnosis to see a clinician. Within the direct access capability of every state, PTs can definitely see that and screen out for that. And that's really quite amazing. So that's the reason why pelvic health and lymphatic health is because they're both needed, because that's a keystone in the body, not only for the pelvis, right, is the keystone there, but also I always tell folks that the lymphatic system for the lower half of us, if you picture like an upside down tree, and like the trunk of the tree is in the trunk of you, the pelvis. And the branches are the branches that kind of break off from like in one leg and the other leg. So if there is congestion down at the bottom of the branches, you best believe there might be something coming up into that trunk. Ooh, what's in that trunk? The pelvis. So we need to be able to do both and. So I hope that was a helpful little tidbit of why pelvic health and lymphatic health PTs are really sought after, because we do both. You don't have to go to two different clinicians or do two different plan of cares and again, all that kind of stuff. You want to seek somebody that can do all of it. And until next time.